Hi class, my name is Megan Mayani and I have chosen to do my capstone project on heroin abuse. The reason I chose heroin abuse is because the preceptor I'm working with has a friend who is abusing heroin right now and has been through a couple different treatment options and none of them have worked. And he's having a hard time understanding why his friend is addicted to heroin and different signs and symptoms he should be looking out for when he relapses, and just different ways that he can help him to get treatment, as well as the fact that in this downriver area up here in Michigan, there's an increasing amount of people who are abusing heroin. And just in the past year, we have actually lost 3 people from my graduating class of 2005 to heroin abuse. What I did for my capstone project is I created a PowerPoint. That PowerPoint is going to be shown during Nurses Week in 2 weeks at the hospital. So there will be a lunch and learn that I will present. It'll be at 2 a.m. since I work the midnight shift. And people can come and see the PowerPoint presentation in a conference room, as well as it will be emailed out to all the registered nurses and the patient care assistants in our hospital. And then after a week after they receive the PowerPoint, they will be given a Survey Monkey to their email as well to get feedback on the presentation, see if there's any questions they have or anything that they want to learn further, because our hospital has a little bit of a difficult time incorporating nurses' education into it when it's provided by the staff for different school projects. So we're hoping that more of us are able to present stuff that pertains to our patient population in the future. So I will get started with my presentation. I'm going to go through the PowerPoint that I created. I apologize that it is a little hard to see. My computer, there's a glare on it, so when we were trying to videotape it, it was hard to see the computer with the glare, and I don't have the means for a projector for just this one project. So I printed off the slides, and I'll talk through the slides. So we'll show you the slide up close and then kind of zoom out so you can see my face while I'm giving the PowerPoint presentation. What happens when you turn to heroin to solve your problems? Heroin is a drug that produces a downer effect on the body. It causes the body to relax and go into a euphoric state, and it blocks the brain's ability to feel pain, which is one of the main reasons why people turn to heroin, is to solve all of their problems because they can't feel them anymore when they have a high from heroin. Why do people become dependent on heroin? People that are dependent on heroin are compulsive drug seekers. It provides a neurochemical and molecular change in the brain. It gives them a pleasurable sensation, and it helps many people cope with the stressors of everyday life. A registered nurse's duty when it comes to heroin abusers is to learn about the patient and what leads them to the drugs. We can help them focus on the future and not the past events so that we can diverge their thinking away from the drug abuse. We can also find them ways to get help, which I will provide later on in the presentation. And we will help the patient with their medical side effects. We will manage such things as withdrawal, medication, restraints, and relaxation. Some different ways that people use heroin. Some people use it intravenously, which has the most rapid onset. It can start working in the body and give you the feeling within seconds to a minute. When they do it, they inject into their veins using a needle and syringe, and then heroin is converted to morphine once it's injected into the vein and is in the bloodstream. This is the most common because it provides the heroin abuser with the fastest effect from the heroin. Smoking is another way that people can use heroin. They inhale it orally through a straw. The onset for inhaling it, they inhale it through a pipe when they smoke it. And the onset with that is usually 10 to 15 minutes, so it takes a little bit longer. And then they can also snort it because when they snort it, they inhale it through the nose using a straw, and it has a 10 to 15 minute onset. When people are snorting the heroin, it's easier for them to hide the different signs and symptoms of being a heroin abuser because unlike intravenously, they're not injecting anything into their body, so it's not leaving any types of marks. The only side effect usually that people can notice when somebody is snorting heroin is the fact that they do get a runny nose quite often. Some of the signs and symptoms of just general substance abuse. Patients can have shortness of breath, a dry mouth, smaller pupils, sudden changes in behavior and actions. They can become disoriented and confused. They sometimes have cycles of becoming very hyper and then they nod off. And they can appear as though the limbs of their body are feeling very heavy. Some of the signs and symptoms of heroin abuse specifically are needles and syringes laying around that are not used for other medical purposes, such as insulin injections, needle track marks on their arms from injecting the heroin, burned silver spoons, aluminum foil or gum wrappers with burn marks. In the spoons, the foil and the gum wrappers are used because when patients are injecting the heroin intravenously, they have to put it into a liquid form in order to get it into the syringe. So they often burn it and then draw it up with the syringes. Missing shoelaces, and you may be wondering why a heroin abuser would have missing shoelaces. Quite often, these heroin abusers do not have access to a tourniquet, which is a rubber band type that we put on the arms of our patients in order to expose their veins, so that when we inject into their veins, it's easier for us to see them. So they will use shoelaces to tie around their arms and cause pressure so that they can see the veins when they're injecting. Straws with burn marks, small plastic bags with white powder residue, water pipes, weight loss, runny noses for those who snort, infections or abscesses at their injection sites because commonly they are not using different needles each time and they often share needles with other drug users, passing diseases on from one another, and cuts, bruises, or scabs from skin picking. Some of the behavioral signs that you'll see in a patient who's abusing heroin, they could have a lying or deceptive behavior. They avoid eye contact with others. They have an increased time sleeping, slurred or incoherent speech, worsening performance in school or work because most often they're thinking of when they can get the next high and they're not very focused. Decreased attention to hygiene and physical appearance because the drug has taken over their brain and that's all they care about at that point. Loss of motivation or ability to set goals. Withdraw from friends and family so that they do not notice that the patient is abusing heroin and try to get them help. Wearing long pants and sleeves in warm weather to hide the marks from injecting the heroin into their body. And stealing or borrowing money. Most often, heroin abusers have a medical and mental issue, but it can lead to criminal behavior because they're trying to get money from others so that they can buy more of the drug. So quite often, they'll go to a loved one's home and steal from a loved one, pawn different items, or get money, get a credit card, rack up stuff on a credit card and sell that to people on the streets so that they can get cash to buy more of the drug. Some of the symptoms of withdrawal. Withdrawing from heroin can occur within a few hours to the day after the drug stops being used. Some of those symptoms are intense craving, profuse sweating, nausea and vomiting, which is one of the main symptoms that we will deal with in the hospital as nurses. So when a patient is experiencing nausea and vomiting from a withdrawal, we often give them Ativan. It helps relax the patient, as well as it also has an antiemetic effect, which is known as an effect that stops the feeling of feeling sick in your stomach. Intense cramping in their limbs, crying, insomnia, cold sweats, chills, runny nose. All of these symptoms of withdrawal can also lead to death if not managed correctly. Abuse of heroin can lead to many serious side effects. Heart problems can occur from using heroin because it can lead to infections of the valve and the linings of the heart. They can get infectious diseases from sharing needles. An interesting fact I found in my research was that after using heroin for 5 years, a patient can develop a 90% chance of contracting hepatitis C. It can also lead to chronic pneumonia, liver disease, blood clots or tissue death from the veins collapsing when they're injecting the heroin into their veins, bacterial infections, arthritis, and seizures. Most heroin addicts purchase their drugs on the streets, and they do not know the strength or what the dealer is mixing the drug with. Sometimes dealers will mix their drugs with powdered sugars, anything of a white substance, baby powder, so that they can create a larger amount of the heroin, but it could be more serious on the body when it's mixed with the drug and they start to have side effects from it. It can also, by doing this and mixing the heroin with other types of substances, can often lead to overdose and death. Where are the drugs coming from? Drugs are coming from pretty far away places, such as Afghanistan, Mexico, and South America. Detroit right now is the center for the heroin. It's fueling areas such as Toledo, Flint, Saginaw, and Lansing with the heroin. And much of this heroin, like I said earlier, is mixed and laced with other drugs or substances so that dealers can keep their supply cheap and have many customers. Some ways to combat heroin abuse. As nurses, we can help the patient journal their thoughts when they're in the hospital. We can help them get involved with yoga, meditation, music therapy, and drawing, which are all relaxation techniques. They can recall happy times. We can try and talk to them about changing their friends. If they go back to the same type of friends they were with before, if they do the same behaviors as the patient, such as abusing heroin, drinking, or doing anything else that could enable the patient to turn to heroin, then we need to try and get them away from those friends and into a different support system so they're not thinking about the drug. We can also help them find a hobby. Most often, heroin abusers don't have a hobby, and their most common thing that they do is use the drug, so we can help them find something to keep their mind off of the drug, bring out their talents, and make them feel worthy. Some of the treatment we can help the heroin abusers to seek, we can refer them to both inpatient and outpatient therapy. There are not a lot of therapy centers here in Michigan. Many of the centers are out west. But when we get them into treatment, we can help them realize that they're focusing on the whole body and not just the drug dependence. So it's not just a medical issue, but it's an emotional and mental issue as well. We can help them focus on the past problems that led them here so we can keep them away from those problems so that they're not enabled to go to the drug anymore. Help them develop new support systems and teach them to stay away from their enablers. Right here is a brochure I created. I'm leaving this along with the PowerPoint, so it's a resource for family, friends, or heroin abusers. Sometimes the heroin abusers are afraid to seek out help and they won't ask for it, but if we have something such as a resource sitting on a table, they may be more apt to pick up the resource, take it home and read it, and actually find some information that could be beneficial to them. In this packet, we just have the signs of heroin abuse. I'm not going to read them again, but they're all listed here that I explained to you earlier so that they can see the different signs and symptoms of a heroin abuser. The second page is behavioral changes. So if a family or friend picks this up, they can notice the different behaviors that somebody is exhibiting when they have heroin abuse. The third page is just reminding them to call 911 immediately if they start to feel any withdrawal symptoms or they just don't feel right. When they call 911, they also should, if they have any of the drug left over, they should keep that with them and turn it over to the paramedics or bring it to the hospital with them so that they can test the drug and make sure that it truly is heroin and it's not laced with any other types of drugs. The fourth page is 3 different resources for the patients. There's a resource out in Brighton. It's a treatment center that is inpatient, and they focus on family involvement and believing that it is an incurable but a treatable and preventable disease. The Livonia Treatment Center is actually special because they reach out to those who are homebound and they're not physically able to come out to the treatment center, so they will take a treatment team out to them and actually help them work with their heroin abuse in their home. The last one is just another resource. It's out in Tennessee. It's a ranch down in Tennessee where they focus on smaller group therapy. So it's 10 or less recovering addicts in a group, and they actually split them up into men and women so that they're not together. Some people don't feel comfortable going with the opposite sex when they're in treatment, so they split them up, and they also have them work on the ranch so they can learn the skills again on how to be a productive member of society. So with my project, my main objective was to inform nurses about the different side effects of heroin, different ways that you can notice patients who are abusing heroin, and to try and help them seek help and develop different relaxation techniques to keep them away from the drug, because what's the point if we just treat the medical symptoms when they're withdrawing in the hospital and we turn them back out on the street? They're just going to keep abusing the heroin and keep showing up at our ER and coming up to our floors. So if we focus on both the mental aspect and the relaxation techniques that I have explained to you in the presentation, as well as send them to treatment and get them treatment options, then we can actually prevent them from coming back into our health facilities.